Hello everybody, I'm John DeSciullo here on Innovations in Health with Dr. Neil Woods from Severna Park Dentistry. Dr. Neil Woods, thanks very much for joining us.
Thank you for having me.
And it's a pleasure to see you, and we're going to get to know a little bit more about Dr. Woods in just a little bit, but our mission here today is to talk about mini dental implants, a life-changing dental procedure. It's affordable, practically pain-free. It's so much to talk about, so let's get right to it. You have some models in front of you, and I know you wanted to start with something that's very important, particularly with people who have dentures.
Right. Well, I wanted to talk about the mini dental implant used for the lower jaw. You know, many people as they get older have no teeth on the mouth. They've lost them. And they're left chewing kind of starchy kind of food. They can't eat vegetables, they can't have a salad, they can't chew a steak if they want to, they just can't do it.
The dentures fall out, there's goo that has to keep them together.
Paste, all sorts of stuff, and they're constantly finding different things to use to try to hold those dentures in. And you watch them and their lower jaw starts to advance, and they look a lot older than they really are. This system takes about an hour, maybe 2 hours if you're slow, to put these 4 implants in, and requires very little bone to put them in.
A few hours, just a few hours?
Yes.
It snaps together. Show us how that works.
It's very stable, all right, and there's no gook around it, and they can chew. And patient come in, and you're working with them, and the first thing can happen is the patient comes in, they have nothing there, they're having a terrible time, they have a lower denture, they can't really afford much. All right, and you can go ahead and within a very affordable price, take their old denture and put these implants in and put this right on top.
And when we talk about mini dental implants, you're talking about a specific metal, a screw that goes into the bone, and then the denture, or the teeth, I should say, then adhere to it. And how long does this procedure take to do?
Well, this one you can probably do in an hour or 2 and you're done.
And the patient walks out with what is in essence a full new set of teeth.
They can walk out with a full set of teeth, or more importantly, the one that's easiest is they already had teeth and you just went ahead and put this in. And they may be the temporaries until you make the new teeth for them, because now they can have teeth that supports their face. Beforehand, they have these little kind of worn out things that somehow they managed to grind food in. And they couldn't have it. Their face looks collapsed. This will restore their face so they look young again.
And it's not only the bottom teeth, it's the top teeth as well.
Absolutely.
Let's show that.
So here, and this is the point that's important. A lot of people end up slopping a whole bunch of paste on the palate to hold the denture in, right? And this prevents that paste from being there. You know, this is a personal choice. If you don't want to have, and this snaps in also the same way this does, if you don't like the idea of using adhesives. And I'll tell you a quick story.
Sure.
My mother-in-law, who was the first person I ever did this on, I made this denture for her, and it was without implants, and it was very tight. I couldn't even get it out of her mouth with no implants. My mother-in-law said to me, you know, I need adhesive because I like that extra certainty that thing is not going to move. So for many people, without having the implants, they're left with having to wear adhesive in order to establish something they can wear comfortably. We can get rid of the palate, all right? We can eliminate the adhesive quality, and it can be done very quickly.
And with that, basically their life is reinvented. It's rejuvenated because they can, as you said, eat better food, eat more properly, feel better about themselves, and not risk that fear that the denture is going to fall out, certainly at the most inappropriate time.
100% correct, and affordable. When you go in and you do this type of dentistry, this is affordable dentistry for most people, and we find ways. We're going to look and see. We're going to find a finance company. We're going to do whatever we possibly can to find a way, because my belief is this is going to change their life.
And we'll get into some of the cost issues in just a little bit, because it's something that I think everybody that's out there watching, if you're thinking this might not be for me, Dr. Neil Woods and his team will work with you to make this something that you can do within your framework of your life. But let's take a look at some of the other models, because if we're talking about dentures and a sort of a full set, but somebody maybe doesn't have a denture, or they're not of an age where that's something that's in their life, if they just have a single tooth or just a few teeth, the mini dental implant will work with them.
That's correct. Well, I'm going to give you a couple examples. This is one that I remember very definitely happening, where the 2 teeth on either side of the front teeth, or 1 tooth, is lost. And there's, again, very little bone. So we can use traditional implants, larger diameter implants, but sometimes the bone is just not there. So that requires bone graft, time, and lots of expense to be able to replace it. The mini dental implant, because it's narrow, actually can be placed in and a tooth can be put on, and it looks just like the natural tooth is there.
That's amazing. So you're putting the one tooth right there,
right,
and creating a full look.
Right, and it's one visit.
And this could be someone of any age, somebody that's experienced a sports injury, or perhaps the tooth itself may have died, or there's some decay. So the one tooth option is available in addition to the full set.
I have a patient I just about finished with, and he's been wearing a partial plate for years. And he had diagnoses in terms of getting implants in. And he had a lateral and a front tooth, so two teeth that were bad. And he was wearing a partial, and he couldn't stand it. He just felt uncomfortable with it. It just wasn't what he wanted to do. Because of the advent of the 3D radiography that we use and the equipment, we were able to place two implants in that area and fabricate two teeth that will work great for him. And he's a nice man. And I've got to know he and his wife. They call constantly, find out what's going on, how can they do this, what are we doing next. Really nice people. And
you said that losing a single tooth and maybe making those procedures is actually quite common. People will lose a few teeth along the way.
100%. It's not unusual at all.
And it's not just one tooth. I think there's an option there where you can have just a few teeth, perhaps in the back part of your mouth.
There is a patient that I had now for probably 10 or 15 years whose mouth had what we call a collapsed bite. Because there were no back teeth, the top and bottom jaw had crunched together. Jaw was here. All right, we were able to place implants in, like this.
There's 4 there, I see.
That's right. And then place a bridge on top of it and reestablish the bite and correct the bite.
Hi, my name is Carol, and I've been a patient with Dr. Woods for about 7 years now. I've had several of the mini implants done, and they've been extremely well taken and easy to do, and I can eat with them just like any other tooth. I don't feel any difference between the implanted tooth and a regular tooth, and I'm very satisfied with the whole experience of having mini implants. And it's been about 7 years, and I'm very happy with the results of it.
What's amazing about the mini dental implant, as we're seeing now on the screen with these models that we're showing, these look so natural. They're colored to the mouth, to the teeth that are in place. And what are they made of?
Well, the material of the implant itself is titanium. The same type of materials we use for certain surgical implants all over the body. All right. In fact, my father had a titanium plate in his head, and my father died at 102. So
God bless.
I think that worked out really well.
So the titanium is the screw, if you will, that keeps the implant in place. That's what goes into
That's correct.
Into the bone.
That's correct. Very simple to put in, not a big deal, and you just place it in there.
Practically pain-free.
I hate to say pain-free. I can say to you that we can make it very comfortable. And if you're listening to the patient, you can make sure they're okay with it without a problem. And that's what we're going to make sure of.
Well, just meeting you, Dr. Woods, for just a few moments here before we started putting this program together, I sense that you have a great history in dentistry. You've been practicing a long time and in the beautiful state of Maryland. Tell us a little bit about you.
Well, I'm a dad. I have 2 great children, and I have 3 grandchildren. And to my surprise, I have a great-grandchild on the way right now.
God bless.
My wife and I have married 47 years. We work together. We spend our entire lives together. And we enjoy caring for people. That's what we do.
And you've been in practice in Severna Park for how long?
I opened up my practice in 1975. And it gets to the point where it's easy for me to say the year I opened it up and figure out the math.
Yeah. Well, and that's okay, Dr. Woods, because what that really tells our viewers out there is that you have a great wealth of experience. And I know that here in Maryland, when a patient comes in to your practice, you listen to them. They may have other issues as well, because your practice is not just about mini dental implants. Tell us a little bit about how you interact with the patient and some of the services that you offer.
It's kind of something similar to what we're doing right now in our conversation. We're going to talk to the patient. Actually, we're going to do a lot more listening than talking. We want to find out why they came in, how they got to find me, and what their expectations that day were supposed to be. And when they walked out the door, what did they want? And we want to go over everything, including what the costs of the procedures are going to be and how they can afford it. So that they come in with a problem, and we want to come up with a solution. And we want them to walk out the door and say, that's one problem that's out of my life. I don't have to worry about it any longer. I'm going to have teeth. I'm going to have a smile. I'm going to be able to chew, and I'm going to be able to afford it.
I came to Dr. Woods. I had no teeth. I couldn't eat. He's done a good job. He made my teeth fit. They fit well. And I can eat anything I want. And I'm doing good. And I recommend him to anybody to do your teeth. Thanks.
And that could be an individual of any age that has those concerns. It could be somebody that maybe suffered a sports injury or there's some medical issue in their life. So it's not necessarily someone who's older who's dealing with the implant issue or any dental issue.
That's 100%. I had a young lady who I treated the other day who came in, and she had a major Crohn's disease, and her teeth had become really bad, and she was in rough shape. And we were able to surgically place implants and give her some teeth to work with. And I know it's changing her life.
That investment in you is not only something that will make you feel better, but it could also help you medically. There are a lot of issues that if you let go with something that might be a dental problem, that could hurt you further down the line.
You certainly can't chew the way you want to chew, and you can't eat the foods you're supposed to eat.
And you don't want to have any pain.
Right, right. So that's the big deal.
And you know, we talked about the connection with your patient. What I noticed with your website is that you have flexible hours. You're open weekdays, some weeknights, and Saturdays. So that opportunity for somebody, a family that's out there here in Maryland and they're working and they can't make it during a regular weekday, you offer that as an option.
I do, and I also I promote the people to be able to call me. My cell phone's available. I give my cell phone out to all my patients, and I want them to call me and let me know what's going on. Especially after a procedure, I'll call them, and then we want to find out that they're happy, they're doing well. And then in the middle of the night, we have a sign on Ritchie High, which is a major highway, and that sign says this is emergencies. You can call us, and I get calls probably once or twice a night for people who are in trouble.
I have never heard of that.
Well, I think it's an obligation. In my opinion, for me, it's an obligation for the society, for the community, to do these things for people, because they're lost without some kind of person to call. And you know, every time a person calls me, my wife will look, oh, you got a phone call, and I will pick up the phone and talk to them.
That's great that you're able to connect like that and find out. And let's talk a little bit about the team that you have at Severna Park Dentistry. It's not just you. You have technicians and other dentists that are there. Talk to us about the staff.
I have a family. I have family people we work with. I have a group of people that I've probably been working with, majority of them for many, many years. I have a great set of dental assistants who work with, kind of fun to be with. It's a group of all different kinds of nationalities and faiths and races, all different ages, lots of young kids who have babies and things of that nature, and some of us who are getting more senior. We have a whole crew. And it's important for us to relate to the patients and get out of the cellular age in which we have our face facing the phone the whole time.
So you want to have that interaction with those patients and with your staff to have that interaction with your patients as well.
Absolutely.
And so as we discuss the mini dental implants, the dental services that you offer, where can people find you in Severna Park? Ritchie Highway is obviously a major thoroughfare.
It's a major, there's two cities. One's Annapolis and one's Baltimore, and we're right in the center between the two of them on a major crossway. And they're just opening up a brand new shopping center right diagonally across from us. But for years, what you would know the area for is for the Early Heights Fire Department, which is right diagonally across the street from us.
And it's 156 Ritchie Highway, and the phone number, we'll have it here on the screen too, it's 410-647-1800. And your website, very easy to remember, SevernaParkDentistry.com.
That's correct.
And all of that information about what we just discussed is going to be on the website. But let's go back to talking to the individual that's out there watching here in Maryland and the surrounding community near you, and they might be thinking, I think this mini dental implant might be something that I need to have happen. How would you consult when the patient comes to you? What's that process from the initial meeting to the individual walking out with that new set of teeth?
Well, the first thing is they come into the door, and they call up the office, and if someone calls and they want to speak to me before they come in, they're welcome to. I may not be able to address them right at that point in time, but I will get back to them and go over any question that they'll have. Once I've spoken to them, or they've just come into the office and they want to get a consultation, right? We set a fixed price on that consultation, all right? And so they know ahead of time what the cost is going to be. Because I always want to know, the patient should always know, what are they going to spend without mystery. So they'll come in, we'll have the consultation, we'll review what's going on with them and find out what they really wanted to have that day.
And if somebody has another dentist that they've been hanging with for a long time, going to for a long while, coming to you should not be considered, it should not be considered a negative. Coming to you for a consultation to find this out, because maybe the dentist they're going to currently doesn't do this procedure.
Mm-hmm.
So when they come to you, this process continues. You have the consultation, you take a look at what is going on in their mouth, you discuss some of the pricing options, and then how does it continue on?
Well, very frequently I'll ask them, do they have a dentist they've been going to? And I'll ask them, you want me to call them? Because they'll be glad to call the dentist and say, and they don't have to have this, some of them are uncomfortable about it. Sometimes they'll come in, they want to find out information, and they haven't made their mind up yet. I said, okay, so I'm not going to say anything. All right, when you're ready to come in, come in. The object is to make it comfortable and easy and not a big deal. We want to take away every single barrier that we can to make it easy for them to come in, find out the information, and move forward.
Is there still a stigma about going to the dentist, that there's a negative there and there's issues? I mean, I know personally, there were many years I didn't go to the dentist. Shame on me, because of that stigma of pain and some of the other issues that go with that. But so much has changed that that should not be an issue. So if somebody's out there and they really need help, they should forget the old stereotypes.
There are two stories that come to mind right away. I have a patient who said to me yesterday, she was in and we were doing implants to replace all her teeth in her mouth. So it's quite an amount of work we're doing. And she said to me, I traveled 40 miles to get here. She said, before I met you, I was so afraid of going to the dentist, but I no longer have that fear, and I wouldn't go anyplace else because I don't worry any longer. I can come here, and you're going to take care of me, and you're going to be listening to me, and we were having a good time. I actually said to Pam, let's go out to dinner together, you and your husband. He said, well, you going to pay, Doc?
Did you go out to dinner yet?
Not yet,
yeah,
not yet.
But you never know, it might happen. And these patients that you have, from what we've discussed and from what I know of your practice, they really feel strongly about the great work that has happened to them.
I'd like to talk in stories, so I'll tell you another quick little story.
Sure.
I had a patient who had been a patient now with implants probably about 10 years, maybe a little bit longer than that. And she has, and there are pictures I think we have that you'll be able to see on my website.
Sure.
And she had what was called a collapsed bite. Her top teeth and bottom teeth were collapsed. She had gained a lot of weight. She had lost a lot of self-esteem. We placed implants in her mouth, established her bite. She came back in and she changed the whole way she looked. All right? And now when you look at her old pictures and her new pictures, she looked better now than she looked before.
It's amazing that you've been able to maybe add a new sense of excitement to that individual's life with dental procedure. That must be very gratifying to know that their lives have changed for the positive. And maybe there's, like you said, there's self-confidence in their social life and even in their professional life. Things could change for the better.
It's what I do it for.
Yeah. How do you take care of the mini dental implant?
Well, it's actually very simple, all right? Once the implant is out, you can brush or gently clean them or use some mouthwashes to keep the area clean. It's very easy, and these can be put into denture cleanser, all right? Here, it's just like your own teeth, right? It can be used in water pick, and these are in your mouth, and you don't take them out. The doctor takes them out once every 2-3 months or longer, or they could even be cemented. All right, in which they really don't come out. They're in, all right? And you could actually use special kind of floss, the floss underneath them. It's just like brushing your own teeth.
What is the actual tooth made of? What's the material?
This is zirconium. And zirconium is a very, very strong ceramic material that resists tremendous amount of heat. All right, so much heat that you could probably use it as one of those pieces of ceramics that are on the outside of the space shuttle to resist the heat of re-entry, that kind of material.
So that's tough.
Oh, it's very tough.
Yeah. So because, obviously with people going through their lives and eating and going about their day-to-day life, the tooth takes a lot of beating.
Absolutely.
So you want to make sure that confidence is there, that it's not going to break.
100% correct.
Yeah. And when we talk about the care and the implant, we talked about the cost. I think it's very important now to talk about that this is a bit of a reinvestment in your life, so to speak. And one of the things that I think is fascinating about how you describe how this works is we can use our fists here to figure this out. You showed us something very interesting about, just to show you how strong this whole mini dental implant procedure is.
Well, if you're a patient and you're chewing and you had a denture on top of your jaw,
okay,
all right, you can see that it doesn't take much to dislodge this denture.
Yeah.
So you put some goop here and you try to get it to stay, and it's still not great.
Still wobbly.
And that goop comes out all over the place.
Yeah.
Now, anybody who's played golf, you have a golfer's grip.
We'll put a thumb up.
Right. And now, see the stability that creates.
Yeah.
Right. And that's not going to move.
So here, I'll show it right here. So this is what you're saying. See, but the thumb is there in place, and the fist is there on top. So that's the strength of the mini dental implant.
That's
in a way
correct.
that I think would be an interesting way to describe it, as opposed to what you had, where it's two, and then the typical situation where it would, with a paste or a glue, not hold as well.
Exactly.
Yeah, very interesting. And how long does the typical mini dental implant last?
Well, I would say that the majority of them last for a long, long time. They are multiple years. And I'll tell you, interesting, I've made this statement to my patients. If an implant fails, I never charge them to replace it. And because it's a small diameter implant, the replacement is very easy.
And this is a minimally invasive technique. This is something that, as we discussed, you're saving thousands of dollars from other older techniques. And this is something where it can happen within a very short window of time. And we talked a little bit about, each individual patient and their particular issue might determine the time. But by and large, this is something that can happen in literally one day after the consultation.
Well, the point is the placement of the implant is very quick. All right, and putting some form of teeth on top of that implant can be done 99% of the time right at that point.
So somebody that's coming in and is expecting that this is going to last or for a protracted period of time, they don't have to have that fear. This is something that's going to happen in a very short window of time.
It can occur that way. Healing is something that has to take place, and that takes time, but you can have teeth the same day you come in. No one walks out of my office without teeth.
I know I've heard from other dentists that an ibuprofen or an over-the-counter pain medication would be just fine to suffice, in sort of an overnight time period for some of that healing process to begin.
The Tylenol and Advil are great uses of medication for pain that occurs.
Yeah. Let's show the viewers, in case you're just now deciding this is something I really think I need to participate in my life. Let's show them one more time, Dr. Neil Woods, the mini dental implant models that you have there.
Okay, so the first thing is this is the one that we talked about earlier. And you're going to watch me kind of fumphering around because you can almost not identify which tooth it is. But one of these teeth right here is actually,
so this
there
shows,
it is.
Yeah, this shows how secure this could be.
Very secure, and you can't really identify it. The nice thing about mini dental implants is because of the system, they disappear in the mouth. And I can go back a month or so after I put it in, and I'm looking at the patient, and I have to go say, okay, which tooth was it? Because you can't tell. All right, it doesn't have anything, what's called emergence profile. All those things are not going to be there, so you can. It's hard to identify that that's actually it's a natural tooth.
And with that natural tooth, there's so much discussion about whitening now, and there's some cosmetic dentistry pieces that and we discussed a little bit about that. You can color that tooth and maybe the other teeth so that the smile can be brighter as a result of the mini dental implant.
Absolutely, you can do a lot of changing from that. Someday maybe in the future we'll have it so portable that people can buy green teeth and blue teeth. Walk around that way too.
Some people have, yeah. And Dr. Neil Woods is here from Severna Park Dentistry, and in Maryland, you want to get the best care possible. We're in a great state, and if you really want to make things happen for you in the world of dentistry, it's not a difficult journey to go to 156 Ritchie Highway. The great staff that Dr. Neil Woods has there. And going back to these models, this is what will happen if you step in for more mini dental implant work. So we talked about the single tooth. Let's look at the next example.
The one that's the most common and the one that's to me is the most life-saving is the simple number of 4 implants on the lower jaw, supporting over the lower denture. all right, and this snaps in. This could be done, and again, in one day. There's diagnostic material, there's information it has to do the job correctly, but the actual procedure and the placement of a denture implant over that is one day. Now, once the healing takes place, you can put snaps on, and the denture snaps on, and it's stably and not moving.
And we talked about this earlier in the show, and if you're just joining us and you're looking at this, or you were here earlier and you saw that example, I really find it to be an amazing procedure, because you go from something that's so sloppy, if you will, and old school, to something that is new age technology, and that it is not that expensive to do. And look how secure that is. Right. Imagine biting into a steak, biting into an ear of corn, you know, enjoying a Maryland crab cake in a way that you maybe haven't experienced before, all because of this.
Well, the big thing is that this is debilitating. No implants, bad ridge, debilitating, and it without teeth in your mouth, you can't breathe properly, you can't eat properly. It's actually a life-saving result to get these teeth in.
Yeah, it's more than just the cosmetics and being able to enjoy some good food.
A lot more.
Yeah. And Dr. Neil Woods and his team at Severna Park Dentistry is where you want to go. And let's talk a little bit about where you're located again. It's 156 Ritchie Highway. And what's your phone number, Doc?
410-647-1800.
410-647-1800. You can call for a consultation. It doesn't take anything to pick up the phone and call and make an appointment.
That's correct. You can ask for an appointment for a consultation. And my staff will tell you that, you know, to come in, it's going to be $1 to come in and talk to me, because we want to make it affordable. We may want to take an x-ray, and they'll tell you the exact cost of the x-ray, and that's what you can expect to pay. And you'll find out what we're going to do, how we're going to do it, what the cost would be involved, how long it will take, help you get financing if we need to, get the whole idea of what we want to do. Oftentimes, when you're there, one of my other patients who's there at the same time, who already had it done, will come in and talk to you about their experience.
Interesting. So the patient can have a patient-to-patient peer experience.
Yeah, very frequently we use that because it makes the patient more comfortable.
Yeah. Oh, I would think so. And then if there's some questions that the patient has, they're hearing it from an individual who's gone through the experience.
Yeah, usually I walk out of the room and let them talk.
Yeah, that's good. But if you take them to dinner, Doc, as we talked about, that's not a bad deal. Yeah. And the website is severnaparkdentistry.com. And you can find out more information. Dr. Neil Woods, you are an innovator in health in Severna Park, Maryland, helping so many people. And we thank you for joining us, and we hope that you have learned some information about mini dental implants and about the great practice that Dr. Neil Woods has to offer. Thank you very much.
Thank you for having me.